Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Did you know that approximately 25% of men in their 40s have BPH? And by the time men are in their 70s, roughly 80% of men will have BPH. So what is BPH? I want to talk about this today in some detail, talk about some different nutrients that can be beneficial to optimize overall prostate function as men get older, and talk about some of the research and science behind different nutrients that can be beneficial. So I'm Amanda Williams, MD, MPH, and let's get right to it. So according to the New England Journal of Medicine, 25% of men in their 40s have BPH. So what is BPH? That is benign prostatic hyperplasia. And we know that BPH is not cancer. However, we do know that it impacts quality of life of men in many different ways. Certainly, when we look at the frequency of nighttime urination and even during the day, but most commonly men will complain about this, about getting up in the middle of the night multiple times to have to go to the bathroom. But we also know that BPH is a major risk factor for sexual dysfunction. So this is also a big problem when we think about the reasons as to why men shouldn't just overlook BPH as part of normal aging. Now, we do know that the prostate gland itself goes through an aging process, as with everything else within the body. And we know that the three most common prostate conditions happen to be BPH, that's that benign prostatic hyperplasia, prostatitis, which is inflammation within the prostate gland itself, and oftentimes this is brought on because of an infection. And then we have prostate cancer. Now, these different conditions often produce similar symptoms in their early stages, making it difficult to really differentiate between them, which is why men should, go and have their PSA levels tested and stay on top of, having frequent follow-ups with their physician once they hit roughly about 40 years old, because we know that this increased risk of the development of whether it be BPH, prostatitis, or unfortunately even prostate cancer. This is why it's very important to make sure that you do go and you do the screenings. Now, let's talk a little bit about some of the common symptoms. Talked about the more frequent need to urinate. So that can be any time throughout the day. We also know is the nighttime awakening. That is, like I said, kind of that key flag that most men will notice. There can also be, burning with urination as well. But we do know that the enlargement of the prostate gland is very common. And we certainly know that there are many different ways in which this can be targeted. Now, when we think about the ways of common treatment, let's just talk in the traditional medicine setting. This is when men will go and talk to their doctor, and they usually get put on something such as tamoxifen, which is going to be Flomax, is the brand name for this. And these different medications, along with even finasteride, which goes by Proscar, these medications are commonly prescribed to treat BPH. Now, we know that, according to the Journal of Phytotherapy research all the way back in 2013, they looked at plant-based nutrients, and they demonstrated that men treated with 320 milligrams of saw palmetto each day for 8 weeks not only experienced a significant improvement in their IPSS score, which is the International Prostate Symptom Score, which is a kind of a standardized tool used to measure the severity of BPH, but they also had a significant improvement in sexual dysfunction scores, which is also very important because remember, BPH is strongly associated with sexual dysfunction. So what they were looking at basically was this large meta-analysis, including over 7,000 men from over 30 different studies, and assessing the impact of saw palmetto and how this showed these significant improvements, the reduction in the frequency of nighttime urination, an improvement in the urine flow rates. But they also saw significantly less side effects. So the men that were taking saw palmetto were not having the side effects that they were having when they were taking the prescribed medications such as the finasteride. So this is very, very important. But now let's think about when we combine different plant-based nutrients that have all been studied in synergy together for the utilization and the support of the prostate. And this is where we can look at Prostate HX. The Prostate HX formulation is a combination of saw palmetto, but what's interesting about our formula is it has 450 milligrams of saw palmetto. Now, the studies that I was just telling you, that over 7,000 men that they looked at over those 30 different studies, that was utilizing 320 milligrams of saw palmetto. And in that 320 milligrams is where they saw the benefit. Now, ours has an even higher amount, 450 milligrams of that saw palmetto. But we also combine in this nettle root extract. Some people call it stinging nettle, but the stinging nettle root extract, it has beta-cytosterol, lycopene, which we actually use a registered trademark form called lycopene. And this is a really important carotenoid for the proper functionality of the prostate. So we'll get into that in just a couple of minutes. Also, this contains soy isoflavones, and this is very important when we think about the natural atrophy that occurs within the urethra itself. So when men are experiencing issues with flow rate or the kind of the stop and go of their urination, this is where that soy isoflavone can certainly be very beneficial. It has garlic extract in this. This is important for a couple of different reasons. Predominantly, we want to think about the setting of inflammation. So for easing inflammation, but also for optimizing proper blood flow. So remember, we're trying to have complete nourishment of the prostate itself. This also contains rosemary along with zinc and selenium. So that's an awful lot of nutrients that are combined into the Invite Health Prostate HX formula. And when we look at why all of these are linked up together, we can certainly understand. All we have to do is basically follow the science in this. So let's talk a little bit about that stinging nettle root. And we know that stinging nettle root has been used widely for BPH. And multiple human clinical studies have shown that nettle root extract is effective not only in relieving BPH symptoms, but also in actually shrinking the size of the prostate gland. Now, in the Journal of International Urology and Nephrology, they looked at the use of not only the stinging nettle, but when you combine that with saw palmetto, and they were finding that these two nutrients together could produce improvements similar to those found in men who were taking prescription BPH medications, but had far fewer side effects. So in this particular study that they are discussing here in the Journal of International Urology and Nephrology, they were assessing the BPH symptoms in close to 300 men. And what they found was when they combined up that saw palmetto along with the stinging nettle, they had a 53% improvement in that urinary flow. Remember I said that stopping and starting. And they found that the actual prostate gland itself had a significant reduction when it came to the actual shrinking of the prostate. So we talk about easing that inflammation. So that in and of itself, very impressive. So you look at our formulation, you say, okay, so they have stinging nettle along with saw palmetto. Great, we know that those have been studied. But let's talk a little bit about pumpkin seed extract. Because back in 2009, the Journal of Nutrition Research and Practice did a double-blind randomized controlled trial. And this was a 12-month study in men who had BPH. And they were measuring their quality of life, their PSA level, that flow rate, once again, the volume of the prostate, meaning the size of the prostate, as well as that IPSS score. So that's that International Prostate Symptom Score. And they found that the way that the pumpkin seed extract was working was actually mimicking a inhibition of 5-alpha reductase, which is important because when we think about those different pharmaceutical agents for BPH, that's what they're targeting, that 5-alpha reductase pathway. And they found that the mechanism of action of pumpkin seed extract actually was doing the same thing. And the results after this 12-month study was that the flow rate improved by over 50%. The PSA level was reduced by 40%, and their International Prostate Symptom Score improved by 70%. So in that IPSS score, what they're basically asking men is, the frequency of urination, the urgency, the flow rate. So talk about, is it a weak stream? Are you finding that you're straining? As well as, how many times in the middle of the night are you getting up because you have to go to urinate? So when we look at a formulation such as the Prostate HX and you say, okay, you have all of these different nutrients that are combined together, that stinging nettle, that saw palmetto, the pumpkin seed extract, along with those other added nutrients, that garlic to ease inflammation and help to enhance proper blood flow, having on board the zinc, which we know zinc is incredibly important for prostate function. When we think about even sperm formation, we know that the zinc, that mineral, is incredibly critical to this. So this is why it's important for men to look at, where their prostate function is. And if you are finding some of these early symptoms, is to be proactive in this and take these different nutrients that can help to better support that aging process of the prostate itself. Now, I also mentioned that we use this registered trademark lycopene, and the lycomata that we're using is a very powerful form of lycopene. Now, lycopene is derived from tomatoes. So when we think about lycopene, that's that bright red carotenoid. And we have certainly recognized that high consumption of lycopene has been associated with a reduction in the risk of developing prostate cancer. And this is a common area of prostate cancer research, is looking at these different carotenoids and lycopene in particular. And they actually have found that even in men who have very aggressive forms of prostate cancer, that those who had the highest dietary consumption of lycopene actually had a 60% reduction in the risk of having a, metastatic form, as well as that risk of dying from prostate cancer. So what we know that lycopene actually does is it not only targets a lot of the oxidative stress, but it actually can help to inhibit the inflammatory process that promotes that prostate cancer. So we know inflammation is never a good thing. Now, what's also interesting is that many different researchers have actually looked at giving lycopene to men and looking to assess if this would do anything in terms of a better regulation in PSA levels. And indeed, they have found that to be the case. I think that for many men, maybe they have heard, having tomatoes in your diet is good for prostate health. And that's part of the reason why is because they have been able to see this in the Journal of Medicine back in 2015. They did a systemic review and a meta-analysis looking at lycopene and that risk of prostate cancer. And they have certainly been able to replicate this not only in laboratory settings, but also in real true life settings, is to show just how powerful that carotenoid can be when it comes to overall prostate health. So I just wanted to bring this to the forefront today, talk a little bit about this, because as we know, many men are dealing with this. Men in their 40s, 1 out of every 4 men in their 40s are experiencing to some degree BPH. And we know that with every decade, that number continuously goes up. So you now realize that there are certain nutrients that when we combine them together can really pack a powerful punch for prostate support. So definitely check out our Prostate HX. Has that saw palmetto, the pumpkin seed extract, that stinging nettle root, beta-sitosterol. It has lycopene, the isoflavone, the garlic, the rosemary extract, along with that zinc and selenium. So that is all that I have for you for today. I want to thank you so much for tuning into the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram. And we will see you next time for another episode of the Invite Health podcast.